This conference will now be recorded.
Good afternoon, everybody. Thanks for joining me for our Allscripts training today. As a reminder, we do record our afternoon sessions for training. So we do ask that you make sure that you triple check that your lines are muted. You can do that in the GoToMeeting application. Make sure that your microphone icon is red with a line through it. And then if you have any questions that come up during the presentation, we do have our chat section that you can send me some messages, send me some questions, and then I will address those at the end of our presentation. The chat is also in the GoToMeeting application. It looks like a little talk bubble, and you can click on that and then send your note to everyone so that they can see that. And then I will try to answer as many of them verbally as I can. And anything that we lose time to answer, I will address on that chat and respond to everybody. So moving forward, just want to talk a little bit about what to expect for our trainings. We have been through our basic workflow, and so now we're going to learn some extra pieces of it. So this is not necessarily the encounter pieces, but the added resources to that. So we're gonna learn through those in the next couple of weeks. We will have training on Tuesday, Wednesday, Thursday, and Friday each week at 3 p.m. We will not have training on Mondays. We will record our afternoon sessions and then make sure that those get emailed out to everybody so that they can stay up to date with our training. On Friday, our structure is just going to be a little bit different. Now that we're in the system, we're learning, we should be testing things, building our physical exam templates, starting to work through our patient intake process so that we can get familiar with that, so that we can build muscle memory as we start seeing patients under the application when each of the divisions go live. And to allow for some more questions as we start playing in the system more and more, on Fridays we will have question answer sessions. So the chat feature will be open to questions that you have regarding the things that we have learned previously, an update, a reminder of how to do something that doesn't seem like it's working quite right. That's the time that we can talk through those. If you have the question, likely someone else has the question as well, and so we want to make sure that we create a conversation for us to be able to have everybody hear the same answers. That feature could get really easy to get ahead of ourselves, and what are all of the things that we don't know that we haven't learned yet? I am going to keep us reined in a little bit and answer questions about the things that we've already learned, or as we've been doing in our questions already, that I will indicate those things that still are coming in our training sessions, whether that is through our webinars like we're doing now, whether it's the before go live trainings or our mock go lives before our division goes live. So join us for that on Fridays. That will be a 30-minute question answer session through chat on Fridays. Tuesday, Wednesday, and Thursday, we'll be learning a lot of extra components to the Allscripts platform that we need for our workflow. So I am going to launch our application, our cloud login here, Click on my Mountain folder and click clinical module. It's now connecting to our remote desktop in order for us to log in to our green screen. In the email that I sent to you on Monday, I did send a reminder that each of your divisions should be housing our training on their local share drive. and each division might be doing that a little bit differently. So if you are not sure where to find those trainings, if you've missed one, please reach out to your division leader and find out where they have those saved so that you can resource those. Not only are these a great training system for us as we are all going live and learning the basics of the system, but we can use this as we have new team members join us, new providers join us, and then refreshers before we go live. We have some divisions that are going live in 2 weeks, and we have some divisions that are going live in 4 months from now. And so it's a really great way to have that resource available at our fingertips to give us a memory charge of what we've learned and how to use the system the way that we have it set up. So here we are on our desktop view. This is how we log in every time. Some things that I would like to call out. We have been through our appointment screen here. We know that we don't have any information right now because we're waiting for our data to be put into the practice management system. The practice management system will then push the appointments to fill this screen with our patient schedule, our clinic schedule. We can look at our schedule, change the day for future days or past days by using our date up here. We can click our caret down, and then we can choose a specific date of service that we wanted to look at, a specific clinic day. We could choose, if we go down to the bottom and click today, if we were on a different date, and then we went to our caret and we chose today, it would default back to today. So that's a shortcut that we can learn. We can also use these buttons to the right of the date. If we click on today, again, if I was on a different date and I click today, it will choose today. If I choose the -1 button, it will take me back a day. And if I choose the +1 button, it will take me back 1 day ahead. So we could use the system that way by 1 day at a time if we wanted to, for instance, see what next week's schedule looks like day by day. We could do this +1, +1, +1, and then we would be able to see what the schedule has built in here for us. And again, if we wanted to go back to today, then we just click this today button, and here we are back on April 28th. So something that we can use as an enhancement as we get our appointments built in there and things start pushing to us from the practice management side of that. So today we are going to go through our print information. We went through our print packs when we signed off on our encounters, and so we know what that looks like, but I want to show you the other ways in which we can we can get information without signing off on our encounters if we wanted it on demand. So here on our desktop view, we have print on our right column. Our print options in our desktop view is going to be different than our patient view. Most of our training today is going to be in the patient chart view, as there's a lot of information to go through there. Here we have our daily schedule that we could print. We have a location caregiver list. That means what is going to be listed on our appointment by location, and we could identify a specific caregiver. Again, appointment schedule. If we were to be at one location, we wanted all of the providers that were at that one single location, we could choose a location appointment schedule. We could do patient demographic records if we wanted to print those on demand. And so those are our options here in our print for our desktop view. If we open up our patient, sure that we click our search training patient box and click search, and then we can launch our test patient. we can, if we go to our print option on our right margin, we have, as you can see, we have different options here. Some of these are the same choices that we have in our print packs that will generate for us. But this is a way that if we wanted, again, to print them or process them on demand before the chart is ready to be signed off. This is some of the ways that we can generate those. The first one is our HIPAA privacy notice. That is built in as an Allscripts out-of-the-box solution. We will be capturing the HIPAA information on the practice management side, so we will not use that in the EHR section, but that is intended to be the signature page for patients to acknowledge that they've received the HIPAA notice. But again, we won't be using that. So we have our physical therapy order here. If I click on that, this screen will populate. It's very similar to our print pack, except for that we don't have that left column to toggle back and forth to the different document selections. If we go to our preview, we could choose, I'll look at it, the full view here. We could see a physical therapy order that we had generated to generate there. If we want to choose edit, it will again populate the information that it will pull the template over, and then we can use our memorized phrases, our A to A, and then we could drop in our physical therapy standing order. And then we can, and if we put all the information that we wanted in there, and once we're done, then we could save it to the chart or send it to the physical therapy department. A couple of things to note about this document, just like our print pack, is that it does not have a character limit. So we could put if you're hitting up against that character limit on the assessment and plan piece of it, then your therapy orders, you could always come in here and make sure that you drop that memorized phrase in directly to the document. So because we're not in the print pack here, it's not going to automatically generate and save to the chart. We would need to choose attach to chart and click that box in order for it to be saved into the chart. We certainly want to do that and make sure that we have that available for us to pull up for the future. We have some options up here that we can use in order to get this document into the hands of the patient or the physical therapist, whatever that might be. We have our print option, so clicking the print would then generate the document to print once we have our printer set up in the system. We have our fax feature that we will have at go live that will be able to fax those to a provider or a physical therapist, whomever we need to do that. We could send it to the queue, which would be our output queue. We're going to learn more about our output queue, but it's very similar to a to-do list. It's how we will manage and keep track of our surgery orders, our imaging orders, physical therapy orders that way. So we could send it to the queue if we wanted to work on it internally. We could save it to the log, which would allow us an action item. We could export it. So I'm going to save it to the log so that it goes into our chart here. You'll see that our button changed from print to save to log. I have my button checked here to attach it to the chart, and if I choose save it to the log, you'll see that if I go into my attached documents here and go into my patient orders, when this generates, we'll see that that new physical therapy order will generate below here. If we go back to our prints, we have our diagnostic imaging orders. Again, that's our for any of our imaging orders that we're sending to OCC imaging, or if we were to need to send it outside of OCC imaging, we could do that through this and create that on demand. Same thing for our lab tests. We have our surgery order form. We talked about this as we populated this in our print packs. Again, if we choose our edit, we could come in here and put our surgery details, either by using our voice recognition, or we could choose the information that we want to populate through our memorized phrases, and then we could cue that to our medical assistant as well. And then again, it's going to populate here in the charts as long as we have that attached to chart box checked in the lower left. So we have our surgery order, patient education, which we went through. This is a way that we could, if we were using a telephone call template, if the patient called and requested to have a note for school or for work to be excused, we could generate that through here. Our medical device letter that we have listed here, if we click on that, this is a form indicating that durable medical equipment or a specific medical device is required by medical necessity. And so you could populate that information either through memorized phrases or type it out, or again, you could use your voice recognition for our medical device letter. We also then have a blank letter. We use that as an example for our Epic Pass. And then we have our patient active medication list. This is helpful if we want to produce our records for the patient of what we have in our chart for their current medications. So for our test patient here, we have that they are on fish oil and CBD oil. And so we could then print this for the patient if we wanted to hand it to them. By using our send web message here, we could send it to the patient portal as well, so that they could have it for their records if they were going to go to another provider's office, they want to take it to their new primary care office, whatever that is, we could produce this for them. And then in order to get it to the chart, we're going to go to our attach to chart. If we were to choose our send web message, it would go to the patient's portal. I'm going to cue it so that we can see what it looks like here. And because I said that we were going to put it in the patient's chart, if I go up here to the patient's chart, I'm going to maximize the screen. I'm going to go to patient handouts. And you'll see that I have our patient's active medication list here. If I double click on that, you'll see a copy of the form that we sent to the patient's portal for them to have a copy of their regular medications. This is also helpful because we're going to be able to download this information, as you recall, from our Allscripts. And so because Allscripts is going to give us a complete list of medications, plus what we get from the patient for their over-the-counter medications, we'll be able to offer a very thorough list to the patient of their current medications that we have. So here I am in the patient's chart. I'm going to minimize that so I can go back to the standard view of my face sheet. If we look back at our print options here, we have a choose output template option that that I'm going to launch. It's going to take us to all of the output documents, all of the documents that we can generate for the patient's chart. I will tell you that it's an extensive list and we will not use most of them, but there are a couple of things that I do want you to see. So here, if I choose output template, again, we have all of these out of the box options that are already created. Some things are specific for states, and again, they won't apply to us. If we wanted to create and send the encounter note to a provider, maybe the patient wants to take it with them, we could on demand create that encounter note for the patient. We would choose it, double click on it. If we preview it, I'm going to look at our full page here, and then we would see what the encounter looks like. Oops, did one too many clicks. So I'm going to come back here to our output template manager. The other thing that we could do is we have our encounter here. We can click on our caret, and then we could choose previous encounters. So if we wanted to create that document or we wanted to pull that document on demand, we could go to our previous encounter. We could click our encounter note, and then we would see that it would generate our preview here. Now, this is already created when we sign off on the chart, and it goes into the patient's chart for our encounters. But this might be helpful if it's something that, maybe our physician is still finishing out their documentation, but we need to get a stat MR or stat ultrasound, and they want to see a note at imaging before they do that. We can create that document on demand and then send it over to them, either by fax or if it's through OCC imaging, then we could queue it up for them to be able to pull. So back here on our output template manager here, again, we have all of the same options that we have on our shortcut on our printing. We do have this work comp form for those of you who see work comp patients regularly. The work comp form, WC-164 form. And if you double click on that and you go to preview, take a look at it, it will pull the information for the referring provider, including the future notes and the diagnosis, to send with the patient for their provider, for their referring provider. We could also send it to their adjuster if we wanted to make sure that that information was sent as the patient is leaving the office. We could certainly do that. You could send it to the patient as well if you wanted to send a copy to them by sending it to the patient portal. And if you wanted to edit it, maybe you wanted to take out the fact that you sent in cultures, you could edit. You could edit it and put the information in here, either from voice recognition, and then you could also go to your auto replace text if you have something that you want to regularly record for the work comp physicians or the adjusters. So here in my auto replace text, I have a 164 auto replace text, that memorized phrase that I could drop into here and put the current restrictions that I want to put on the patient. You can create this however you want. So again, just like we did in our other workflows, if we choose an auto replace text and we want that to be our 164 template, we can put in work restrictions. We could then go down a couple of lines. We could say back to work date, whatever that is, the things that you find valuable on that 164 form that you might be filling out currently, either in your system or by hand. You can add that information here in your template, click OK. And then here, when you are in the document, you can go to your auto replace text. I can drop down my 164 template, and then I can put my work restrictions in here by either adding then another auto replace text, or I could then dictate the information that I want to be included in the 164 form. It will auto-populate with the information from the patient's chart regarding their assessment and plan. and their future orders. So identifying that the patient has been identified for surgery, and then any of the diagnoses that were applied to that patient for that encounter. So with that said, we want to make sure that we're only sending the information that applies to the work comp injury. And so we could, again, remove the items that don't apply to the work comp injury. We could remove those diagnoses as well. So then if we hit print, I have asked that this go to the chart here and click print. I don't have a printer set up, so I'm going to cancel out of that. And then you'll see again here in our patient's chart, because we sent it there, as it gets updated, you'll see that it is going to generate here in our attached documents for our patient. So you can always, as long as you click that box in the bottom left, you can always make sure that it is included in the patient chart. So going back to our print, so our print options, we're going to go to choose output template. Again, we have lots of choices here. Take a look at the things that are already created. You'll see that there are injection consents and office procedure consents. Take a look at those and see if that's something that can be beneficial to you. As a level 1 criteria from COPIC, it is recommended that and required, I guess, that we do in-office consents for injections. Those can be verbal, but we do need to make sure that we record them. So if a patient asks for something in writing, then we can certainly, if we're comfortable with this information, we could generate this and send it to them either through the patient portal or printing it for them. And then again, there's a lot of information that we just might not find value of, but it is available to us if we wanted to, if we needed it. So take a look in here, see what you feel comfortable with, and know what your options are. Physicians, it's a good place for you to be comfortable with, but staff, make sure that you know what you can pull and how you can edit these letters. So whether maybe a blank letter is best to provide documentation for a patient, or using that work school letter, and then building on that work comp 164 form to be as accurate to your workflow as it can be. So that is going to wind up our training for today. And it doesn't look like we have any questions in our chat right now. I'll stick around in the chat for a little bit longer. If you have questions, please share that there and I will respond to you. Thank you guys for your time today. We'll see you tomorrow at 3 o'clock for our next training.